Hello, and welcome to Elevator Pitch series for the radiographer. I am Michael, and this is the second video in the series on radiographic equipment. In this video, we'll be looking at the components of the conventional X-ray unit. We'll be looking at the X-ray tube briefly, the tube support, the console, the X-ray transformer and the X-ray table. In the fourth video of this series, we extensively discuss the components of the X-ray tube. For now, let us look at some basic features of the tube. First, it is a diode, which means it has a cathode and an anode. And it is the piece of equipment that is responsible for producing the X-ray photons. Electrons from its cathode accelerate towards the anode to produce these photons. Let us look at the X-ray tube support. This is the mechanism on which the X-ray tube is mounted. It supports the tube. There are certain features that a good tube support system should have. It should permit easy and unrestricted movement of the tube. There should also be a lock mechanism in place to prevent unwanted tube movement. A good tube support will also enable the tube to be directed in a horizontal, vertical or angled manner when needed for projections in such directions. There should also be a counterweight system to prevent the tube from tipping over on its weight. There are three common types of tube support systems. The first that we'll be looking at is the floor-mounted system. This is made up of a vertical column which is labeled on the diagram. The vertical column runs on the floor rail. Picture how a train runs on its track. In this configuration, the X-ray tube is attached to a cross arm that runs up and down the vertical column. The movement you will find available to floor-mounted supports include horizontal movements along the length of the X-ray table, indicated by the red arrow, up and down or vertical movement of the tube along the column, indicated by the yellow arrow, angular movement of the tube along the cross arm, indicated by the green arrow, and pivot movements of the tube around the column indicated by the blue arrow. Floor-mounted tube support systems have the advantage of compactness. They can be used in rooms with low ceilings. However, because their vertical column is attached to only a floor rail, they are less stable. Also, some less sophisticated floor-mounted supports do not permit pivot movements, making patient positioning more difficult in certain situations. Next is the floor-to-ceiling configuration. This is similar to the floor-mounted models. Its major difference is the fact that the vertical column is attached to both a floor rail and a ceiling rail. The same set of movements in the floor-mounted tube support are available to the floor-to-ceiling tube supports. This configuration has greater stability because it is not only supported on the floor, but also has a ceiling rail keeping it in place. However, these usually have longer vertical columns, implying that they need rooms with high ceilings. The last X-ray tube support system that we'd be discussing is the ceiling suspended or ceiling mounted tube support system. This differs greatly from the other two configurations. In this, the tube is suspended from a telescopic arm which runs on two pairs of rails. On the diagram you'll notice a longitudinal and transverse pair of rails. The movements available to this configuration include transverse movements across the X-ray table by using the transverse rails, longitudinal movements along the length of the table by using the longitudinal rails, vertical movements towards or away from the X-ray table, and a very wide range of rotation around the telescopic arm. The advantages of ceiling suspended supports include the very wide range of movement it offers, much greater than that offered by the other two configurations. This makes patient positioning much easier when ceiling suspended tube support systems are used. Also, the tube can be carried to any point in the room. This means that stretcher patients can be radiographed without the need to transfer them to the X-ray table. However, this system is more complicated than others and would require much more practice. Also, not only does the ceiling need to be very high, it also needs to be reinforced to bear the weight of the rails, the telescopic arm, the tube and all associated cables. Also, this configuration is usually the most expensive of the three. That takes us to the X-ray table. This serves as a platform on which a patient is supported in many X-ray exams. A good radiographic table should have certain salient features. Its top surface should be made of a material that permits radiation to pass through, a radiolucent material. Examples of these include carbon graphite and bakelite. It should also be resistant to scratch. This is because scratches can serve as hiding places for germs and they can be reproduced on the radiographic image during Bucky exams, reducing image quality. Also, the table should be able to support the weight of an adult without giving way. By giving way, I mean getting damaged. There are three common types of X-ray tables. First is the fixed table. This cannot be moved during an examination. It is usually less expensive. However, because it is stationary, patient positioning can be more challenging. Next is the floating top type. In this, the radiographer uses a foot pedaler switch, seen on the diagram, to move the top of the table horizontally in a floating-like manner. This makes patient positioning much easier, but it is a more expensive variant compared to the fixed. Next is the tilting radiographic table. This is the most advanced of all tables. Depending on how sophisticated it is, it either uses a mechanical or electrohydraulic system to cause the entire table to tilt from a horizontal to an erect position, and any angle between the two. Accessories such as shoulder braces, foot rests and handrails help to prevent the patient from falling off the table. The major advantage of this table is that its wide range of movement makes it useful in special radiographic exams where the patient needs to assume different positions. However, these are the most expensive types of tables. The next component of a conventional X-ray unit that we'd be looking at is the console, also known as the control panel. This device is used to switch the tube on or off. It enables selection of exposure factors and also contains the exposure button for initiation and termination of radiographic exposure. Think of it like a remote control for the X-ray tube. On this diagram you would find features such as the on-off button, the exposure button, the KV and MAS selector buttons with a meter to indicate which value has been selected. You'll also find something known as an anatomical program. The anatomical program enables the radiographer to select a body part and size that is to be imaged, and it automatically suggests the exposure factors that would be suitable for that body part. The final component of the X-ray unit that we'd be looking at are the X-ray transformers. In the previous video, we learned that transformers are devices that step up or step down voltages. Let us look at how this applies to radiography. There are three common types of transformers in radiography: the auto transformer, the high-tension transformer and the filament transformer. The autotransformer is named so because it is made of a single copper wire that is coiled around an iron core, making it both its primary and secondary coil. It obeys a special principle called self-induction and can either step up or step down voltages, depending on the situation. This transformer helps in radiography to correct any fluctuations coming from the mains by stepping up or stepping down as needed. It also allows selection of the kilovoltage applied to the tube. Next is the high-tension transformer. This is a step-up transformer. It is placed next to the X-ray tube. As stated in the previous video, the only thing between the high-tension transformer and the tube is a rectifier. Because it is a step-up transformer, the high-tension transformer steps up about 200 volts of electricity coming in from the mains into thousands of volts. What we know as kilovoltage for X-ray photon production. Last is the filament transformer. This is a step-down transformer connected to the filament of the X-ray cathode. There are usually two filament transformers in an X-ray unit. This is so because there are usually two cathode filaments, a broad and a fine focus filament. The filament transformer steps down the 200-volt electricity to about 10 volts to supply current at low voltage to the filament for release of electrons. That concludes this video on the components of a conventional radiography unit. We look forward to your questions and comments in the comments section or via email. If you loved this video and would want more content, please subscribe and share with your colleagues. Until next time, do enjoy the learning process and take care.